now all set to bring to you our next session on digital as a core capability, connecting business to deliver value. But before I introduce to you our expert speaker, I'd once again like to take a moment and request all of you to share your thoughts with us on Twitter, on Instagram, on Facebook, and do remember to tag us using our hashtag ETGDI Summit. I'd also like to thank our partners, our presenting partner, Intel Plus Oracle, our co-presenting partner, JP Morgan, co-powered by partner, Brilio and Connect. May I also thank our cybersecurity partner, Process IT Global, our gold partner, Clear from the makers of Clear Tax. May I also thank our associate partners, HCL Technologies and Goldstone Technologies, along with our startup partners, Fredgenics, Verfin Tech, Satshore, Jal Technologies Prakriti, YCLEPT4E Labs, our knowledge partners, Deloitte, and of course, the summit has been brought to you by ET Edge Unwired. A lot of excitement for you in store. Do stay tuned for all our tracks that we have for you through the day. I'd also like to encourage you to visit our partners in the partner booths. You have a big chance of winning yourself some exciting gift vouchers worth 5,000 rupees from ET Edge. But for now, let's listen on to none other than Mr. Jimmy Jagwani, Vice President and Head of IT Portfolio Management, Bayer AG, more on digital as a core capability, connecting business to deliver value. We welcome you, sir.
Thanks a ton, Isha, and thanks for the introduction. I'm very excited to be here. So while I lead today the IT portfolio management, till recently I was leading digital transformation and innovation, and this brings me closer to the topic today. So I'll give a little bit about what we have been doing at Bayer and talk a little bit more about our purpose. So because whenever we talk about digital, we talk about technology, processes, people, but here I would start our purpose first, because at Bayer, when we look at digital transformation, innovation, we always start off with our purpose, which is health for all on one side and hunger for none on the other side. If you look at it, these are one of the most fundamental needs of human being. So this is what drives us. And once we are clear about this, then we think about how to leverage technology, processes, and people for improving our functions, and also, I would say, at individual level, the processes. So in a nutshell, I would say for us, we always start off with our purpose, which is health for all and hunger for none. Let me set a bit of the context in the world that we are living in and why this purpose is so close to our heart. So we talk about a world where you would have seen these numbers before, but it's very important to set the context. We are talking about roughly 83 million people being added year on year. And for 2050, we are talking about a 10 billion population. Now, this also includes 20% of the population, which will be above the age of 60 by 2050. Sounds cool, sounds nice, and seems that the human race is achieving the next level. But interesting to see that the aging population is affected by various kinds of diseases, chronic diseases, chronic lung diseases, cardiovascular diseases, etc., etc., etc. And more so, even with the younger population, we are seeing now chronic diseases due to lifestyle, now due to pandemic. There's a different way of looking at the world. But this was to set the context where we are talking about growing population and increased disease or increased need for basic health. The other thing I want to draw your attention on is the climate change. Well, we all speak about it. We all know at a high level that the temperatures are rising. Since 2010, we have seen the 5 highest years with temperatures. We see a lot of floods. We see droughts on one hand, but it has implication in the businesses that we are running. For example, the farmers, they are getting less and less arable land. The biodiversity of the soil is getting lost, and that is leading to less and less yield. So you imagine a situation where on one side the population is growing, and on the other side, the arable land which is available to farmers is going down. I'll talk a little bit about health in a few moments, but let's talk about what we are doing on how we are leveraging digital transformation and innovation in our digital farming solutions. So when we talk about farming, we are now working on AI-based, I would say, data sets, which we collect not only from satellite data, but also from drone data, which is used to provide better solutions to farmer. Now, what it means the first thing that it means that the farmers, which can be both high acre farmers as well as smallholder farmers, have access to solutions which are more customized for their own lands. So this is clearly number one. They can decide what are the better, I would say, solutions for them. The secondly, and which is again important, is regarding the use of resources, whether it's pesticides, whether it's seeds, whether it's fertilizers, energy, water. How do we minimize the use of these resources? How do we do this? I told about the AI-based platforms that we have. One such platform is Climate Field View. Again, we have been working on it over the last couple of years and have been improving it and getting very positive feedback from the farming community, which has been using it. Now, this is also allowing us, on one hand, to increase the yield for the farmers, which definitely is the case. And number two, reduce the resources which are consumed herein. I mentioned the resources, so I don't want to go into it. But there's a third important element that I would also highlight here. Now, because of this optimized usage of resources on farming, we would also see net reduction in greenhouse gas emission with respect to the farmland. And Bayer has committed to 30% reduction for our farming customers by 2030. This is again an ambitious goal that we have set out for, but we cannot do this without using digital technologies and innovation. FieldView being one of such examples. Now let me move to our, I would say, other business that we have, which is regarding digital health, where we are again using digital technologies and innovation. And how do we leverage the technologies? Primarily for three different aspects. Number one, it is used for earlier diagnosis of diseases. That's clearly, I would say, allowing us to take early measures. Secondly, precision medicine. This is very similar to the aspect that I brought in for digital farming, but here we are talking about very targeted, I would say, applications for individual patients. And last but not the least, even in terms of the discovery and development of drugs, which typically takes 10 to 15 years, that time span is being brought down. What it means that people in general will have faster access to medication, which earlier used to take 10 to 15 years. With now digital and data technologies, we will be able to reduce this substantially. I would say with growing years, we can also see what's the real impact, but it's going to be substantial in terms of time to market or getting early drugs to the market for the patients. Let me also elaborate this with one or two examples that where we are, which again is number one, very close to my heart, and again very important for Bayer as an organization. So number one, we talk about the example of a rare lung disease, which is, again, this is specifically talking about chronic thromboembolic pulmonary hypertension. This is one of the rare lung diseases. Now, how we are trying to address this is, number one, by using radiology images. So use the data from radiology images on one side, and on the other side, we are looking at the history of pulmonary hyperembolism. And with that, we are able to detect patterns early enough so that we can start addressing the patients who have the tendency for CTEPH. Similarly, for cardiovascular diseases, we are targeting especially those who have high chances of stroke, or even for recurrence. We are working together with Broad Institute, so co-developing an algorithm which will allow us to detect these individuals early. On one side, we look at the patient's chronic history, the clinical history. On the other side, we also look at demographics. We do all this following ethical procedures. Now, the next thing which I would also like to bring, which we'll talk about, where I wanted to talk about early development of medicines. Here we use different kind of technologies. Number one, in terms of drug discovery, this is the research of any drugs typically takes between, say, 6 to 8 years. There are multiple molecules which are tried and tested so that we can get the best solution. Now, with the help of artificial intelligence, mostly machine learning, we will be able to substantially reduce this time. Again, there are ongoing MVPs going on, and over the period of time, we will just get better at doing this. And last but not the least, which is more at a late stage development phase when the drug has been discovered, and now it's about ensuring that the clinical trials run smooth. You would have heard about virtual clinical trials, which means that when the clinical trials are going on, the patients don't need to come at the clinical trial site. They can be in the comfort of their zones. With the help of IoT, we are able to detect the impact of any medication during the clinical trial phase. And also, while we are even stratifying the patients, we are also being able to use data to see which patients is it more important, which patients is the drug more important to. Again, we do this in the most ethical way, and which is allowed by industry. Now, these were two examples, but I specifically wanted to share this regarding the ethical practices using AI. So on one side, it looks very good that we are leveraging AI to get faster drug discovery, get earlier diagnosis, and also to treat patients in a more precise way. On the other hand, we have to be careful in terms of how we use this data, because you would have heard this before, but I again want to emphasize here, we have to be very careful about the data privacy issues, about self-determination. Do people know exactly what they are getting into? And last but not the least, yes, because of technologies, there is potential for loss of jobs and disruption of business models. So we all have to be careful whenever we are talking about digital technologies and innovation. So in a way, I wanted to summarize what digital technologies and innovation means for Bayer in terms of our two businesses. First, digital health. It allows us to detect diseases earlier, as I mentioned. It allows us to have tailored treatments or applications for individual patients. And third one, which is more important for and very close to my heart, is develop new drugs faster and more efficient. I gave the example of using AI for drug discovery and also for virtual clinical trials using IoT. On the digital farming side, it's about making overall agriculture more efficient and also to be less, I would say, to be more sustainable and have less ecological footprints. So that was in summary for me. And again, thanks a ton for bringing me here. I was happy to share my perspective.
Thank you so very much for joining us. It was absolutely fantastic listening to you, your experiences. I'm sure that our audience had a lot of takeaways from the talk. At this point, I'd like to mention that all the attendees stand a chance to win rupees 5,000 gift vouchers from ET Edge. Please do visit the leaderboard TNC for more details. All you've got to do is visit our partner booths, download assets from partner booths, tweet about us, and do remember to use our hashtag ETGDI Summit. I'd like to request all of you to please fill and submit the feedback form, because that's how we get to know what you think about the various sessions that we've put together for you. It's been a pleasure having a very active and interactive audience like you. So please do stay tuned for our next session.